Welcome to the Explainer. We're covering key pediatric imaging associations. Let's connect the visual clues to the diagnosis.
Let's kick things off with a classic. You see this double bubble sign? What's the first thing you think of?
Exactly. It's duodenal atresia, which is often linked with Down syndrome. This is a great starting point for us.
Okay, first up, reading the chest. Here, clinical history is going to be your best friend.
If you see granular lung opacities, age is everything. For a premature infant, it's RDS. For a term infant, pneumonia.
Delivery history is just as important. Fluid in the fissures? That's TTN. A ropey pattern in a post-term baby? Meconium aspiration.
For more complex lungs, look for these patterns. They point to some pretty significant underlying conditions.
When it comes to bronchiectasis, location is the key clue. Lower lobes point to primary ciliary dyskinesia, upper lobes, cystic fibrosis.
And hey, always check the stomach for air. No gas bubble could mean esophageal atresia. Too much, an H-type fistula.
Okay, on to section 2, decoding the abdomen. Let's see what clues we can find.
First, the single bubble sign. This points right to a gastric outlet obstruction, like pyloric or antral atresia.
And there's our familiar double bubble. This is the absolute classic clue for duodenal atresia.
But watch out, a single bubble with distal gas, that's an emergency. You've got to think mid-gut volvulus.
With a vomiting infant, the color of the vomit is critical. Non-bilious points to HPS. Bilious, that's a red flag for volvulus.
Here are two key imaging signs. A corkscrew duodenum means volvulus. A reversed SMA and SMV means malrotation.
The length of the microcolon is a huge clue. Short means colonic atresia. Long points to meconium ileus.
And if you spot a sawtooth pattern on the colon, that's your classic sign for Hirschsprung disease.
Let's finish up with some vital organ clues. This is where it all comes together with key syndromes.
Here's a great example of a bigger picture diagnosis. You see a subglottic hemangioma? You gotta think Fay's syndrome.
The spleen and biliary system give us powerful clues about what's going on systemically.
A calcified abdominal mass in a neonate? This one is a near certainty. It's almost always meconium peritonitis.
Lastly, a couple of key hepatic findings. A cystic liver mass in a newborn points to mesenchymal hamartoma.
So pattern recognition is everything, right? Mastering these is how you build your diagnostic confidence. What will you spot next?